All right, so we're working through these articles. It does get a little tedious here. I don't think it's that tedious because I find all these issues. So why is the government shut down right now? So the Democrat Party is talking about these subsidies. So just not to be cynical, but why did the Democratic Party put a December 2025 deadline on that? Why does Congress put deadlines on things that they know they're going to extend? Yeah, have y'all heard those stories? So the budget office has to price things out, and there's rules that you can't spend more than a certain amount, so they have things stopped so it doesn't mess up the budget rules, knowing they're going to extend it later. So it's, to me, fairly deceptive. Way to do that, it's the way the game's played. Both parties play it. So the Democrats set it up to have it expire in 25. Why? Because they couldn't afford to have it go out as long as they wanted to go. Republicans are saying we're not negotiating on this. So it's interesting. You know, we're what, 21 days into this, 22 days into this. The record is 35 days. Do you think we'll set a record this time? 35 days. Some people are saying this is going to extend into November. If it extends into November, that would get us a new record. That would be interesting. So it's not an election year, right? Next year is the election year, so that changes the dynamic some, but it's interesting. But this whole thing was related to the healthcare side and the cost. But what do you think when you hear that the government's not going to provide these subsidies? What does that imply? Does that imply that the insurance, the people buying the insurance are overpaying for the insurance or underpaying the insurance when they get their subsidies? Do you think insurance companies are grossly overcharging and subsidies getting back to what they should be paying? Or do you think the insurance companies are paying what they should pay for the charge for the risk and the government's subsidizing them down to a lower amount? I would suggest it's probably the latter, which means what? Your generation is going to pick up all the pieces, right? That subsidy that they want to pay. Why? Because why is health insurance so expensive? Because the claims are really expensive. So yeah, the government's providing subsidies because health insurance is very, very expensive. Why? That's what we're talking about here. Why is it so expensive in the United States? And if you provide these subsidies, all you're doing is you're having taxpayers make up for what, you know, people should be paying $2,000. The government's going to subsidize that down to $1,000. That means $1,000 has to come from somewhere. So we're always asking the supply side, why is this product so expensive? And the government says, we have no clue, but we're just going to focus on the demand side. We're going to make sure the demand side can afford this product that's grossly overpriced. So, all right. So one of the issues is quality. So this article is saying the government should release more data on price and quality of doctors. I absolutely agree with that. I'm not sure about the price side, if that would be understandable, but the quality should be. So the solution here, and this is not a bad quote on the consumerism side. I'm going to copy it down to the consumerism side. One of the solutions. I'm giving you quite a few on the consumerism side, but you're seeing that's a pretty common theme. One of the reasons insurance is so expensive in the United States is that people buying it are not paying for it directly, they're paying for it indirectly with lower wages. If you want to fix the healthcare system, you've got to make it a competitive product that's paid for directly by the people consuming it, because then they'll be picky. They'll price shop, they'll quality shop. So some form of choice. All right, so here's a pretty recent article that you could use. Remember that beginning section where I talk about the overall problem? This one fits perfectly in that area because it's a couple years old. It's not that old if you can find something more recent, but remember right at the beginning, size of the problem. You really probably want a graph there. And this one fits pretty well. Sorry. Yeah, I don't know how. Boy, all right, let me try this all again. I don't know where I can put it. Bill Gates won't mess it up, but there we go. So that one's really, really good. I have some other articles that are much, much older. You're going to see it's not that much different. I think the biggest thing is we normally talk about the UK being the model. Here he's showing Japan as the cheapest. I wonder if Japan's not the cheapest for something we're going to talk about later, which is lifestyle. In Japan, I was talking to a nurse in my MBA class. She was talking about in Japan from preschool, they teach healthy eating, healthy exercise, very young age. And so Japanese do live a lot longer, right? When we look at the oldest people in the world, you usually see a Japanese person somewhere in the top 10 on the men and the women. So they may just be healthier. UK is an entirely government funded. So UK is both government provided payment and government provided services. The doctors are actually UK employees, government employees. So they're like the VA in the United States. The government provides everything. And then you have a mix. Canada, you hear a lot as an example of a government provided program. But the US stands out. Now, why does the US stand out? Y'all know I'm blaming it on the tax code. The tax code encouraged the use of insurance. The use of insurance, I think, encourages heavy, heavy, heavy usage of the system, over usage of the system. Other people say the US is more expensive because it's private. It's not government provided. What percentage of US hospitals are for-profit versus charities? Majority of them are not for profit. So you can't blame profits. It's hard to say, so when you try to figure out why US is so expensive, I blame it on the tax system for setting up this whole mess that we have today. Some people say it's because we're using the private sector versus the public sector. How do you believe about that is probably going to influence your solution. If you think it's because we have the private sector doing it, you might be more on the Medicare for all solution. Let's be more like the UK. Is the UK system perfect? We'll quickly see no, it's having a lot of the same problems we are. It's actually having some of its worst years right now. If you don't believe me, look at have y'all seen the polls in the UK on the Labour Party? What they won a huge election victory, and now they're like as unpopular as you can possibly be, and healthcare system is a big part of that. So it's not easy. Even the people who are, the cheapest out there, they're struggling mightily. But the US has a serious problem that we have all the problems the UK have, plus we're more than twice as expensive as the UK. And we don't live as long, and we're not as healthy, and we spend more. So it's a pretty serious problem. All right, so the United States spends about 13,000. No other country comes close. What do Americans get? Our health system does tend to produce more innovation. That is true. We do have procedures in the United States the rest of the world does not have. Well, one exception is in Costa Rica. They have something I was talking earlier. I'm taking a team to Costa Rica in January. Our doctors in Costa Rica have one thing you can't get in the United States, but that's pretty rare. Usually the US is first on everything. But are we healthier? We have the lowest life expectancy of any high income country. Now, is that because there's something wrong with the healthcare system, or is it because of oh, I don't know my drugs, fentanyl, meth? I don't know what any of these things mean. Cocaine, LSD. I have no clue what any of those things are. I mean, I'm not saying that sarcastically. I really don't know what those are. And marijuana. Is it alcohol use? The US actually drinks less than all of other countries, so that may not be it. Is it smoking? US actually smokes less than other countries. Is it exercise? Could that be it? Is it lifestyle? Are we too sedentary? Or is it something wrong with our healthcare system? So that's kind of what you have to ask. But we're spending a fortune, and there's no evidence that we're materially healthier. In fact, there's some evidence that we're actually less healthy than other countries. So how much of that is the healthcare system versus just our kind of the nature of our societies? So here they're going to give you the answer. The main reason US health spending is so high is not that Americans are sicker. The main reason is almost every form of care costs more. I still don't think that answers it, because if we are less healthy, we'll debate that. We're going to see some other articles that ask that. So doctor visits, hospital stay, drug prescriptions, surgeries, sorry, everything we spend costs more here than other places. I'm going to show you some pretty shocking numbers. Like in the United States, that costs $150,000. In India, it costs $2,000. That's a pretty big difference. Now you might say, but India is not as high quality. And you look at the numbers and find that India is actually higher quality than the United States. And it costs, 1-2% what it costs the United States. So we're going to see some pretty radical numbers. We've seen what President Trump and Biden both have done on pharmaceuticals is why does US pay more than other countries? And there's a sense that US consumers of healthcare are subsidizing the rest of the world. We're the ones developing all these drugs, testing them, and then when they're all ready to go, they go to the rest of the world cheap. So we'll talk. So I don't think this is the definitive answer, but the person who wrote this article was saying that it costs more here because it costs more here. The American healthcare system maximizes the profit of healthcare companies at the expense of family budgets. So they are blaming it on the incentives of profits. Here's life expectancies by countries. You notice Japan was the cheapest and their people lived the longest. So they've got a strong argument to make that they've got their system figured out. We're going to see some other countries that you might be pretty shocked on the list. I forget. Oh, is it Vietnam? There's one country you might not think would be ranking really, really high, but it's tried something radically different, and it's actually other countries are coming to copy.
How much does families living together and not maybe going into nursing homes necessarily factor into that?
Well, we'll talk about the end of life care. That is an issue. I don't know if I can say it's worse in the United States than other countries because UK is facing that as well. As far, you could probably find some data that there's more single households in the United States than the rest of the world. People just living completely alone. But I don't know, there's a lot of people not getting married in Japan, and they're doing pretty well.
But you've got the generational factor where a lot of times you have 2 or 3 generations
living
at
together.
least living together.
Yeah, I don't know if that's true in Japan. You could look that up. I don't know. There's a sense now that younger people in Japan are living alone. So I don't know. Yeah, there's certainly a lot of single people households in the United States where their parents are being placed in assisted living. My mom's in assisted living, but it's because there was no way we could take care of her at home. And her medical needs are too much. And she's been in assisted living for almost 2 years now. I mean, usually you go to assisted living, it might be 3-6 months, but you can stay there quite a while, especially with Alzheimer's. So yeah, I don't know. You'd have to kind of compare some statistics. I'm sure the statistics out there. I don't think these articles will hit that particular issue, but if you want to add that as your extra research, it would certainly work. And Japan stands out though, doesn't it? So is that lifestyle or is that their healthcare system? I can't remember what kind of healthcare system Japan has, if it's government provided or what, but Japan has a lot of problems, but it looks like their healthcare system is doing pretty well. Other countries tend to hold down healthcare costs through regulation. We'll certainly see that. In the US, policymakers here, by contrast, allow the market to operate more freely, but competition often fails to bring down prices. Why? Because the consumer is not involved in the equation. Many other countries are also aging. So here, Justin, your point, and struggling with long-term care, but the problems are worse in the United States, but they don't give us any data. I don't say mean the problems with aging are worse in the United States or what, but every country is aging. Even China, most people think, oh, China has all these young people. China is aging as well. India is not quite yet, but India will one day get to become an aging. Now, why aren't people, what's the problem? I've seen several articles in this, The Economist. What is the problem with people having babies? So is it because wealthy people are having fewer kids? Is it professional women? There's a lot of people who think that professional women are delaying childbirth. But do you think that's the reason? So what is the reason? It's actually that the poor part of our populations are actually having far fewer children. The lowest income groups, bottom 25%, are having fewer and fewer children. So the wealthy, yeah, there was that where people were professional, so only have 1 or 2 kids, but that's kind of settled out and it's not reducing anymore. It's actually, you're seeing more and more people with high school degrees or high school dropouts are having fewer kids, and that's really what's bringing down the birth rate in the United States. I mean, these problems are pretty interesting. People are studying these in quite a bit of detail and trying to figure out what's the solution for that. I don't really want to get into Affordable Care Act. But is it working? So what we're gonna look at here is, here's a chart. It's very, very old, but you can see what President Obama was dealing with when he was looking at the Affordable Care Act. And why they called it Affordable Care Act, the United States. This is another way you can do that. You can probably find a new chart. I'm sure if I just Googled it, healthcare as a percent of GDP by country, I'm sure you can find something out there. Probably charts will come up. ChatGPT comes up first. Look at that. You got them all. Afghanistan's pretty expensive. Why Afghanistan's? I have no idea. Mainly because their GDP is probably small. United States 16%, Germany 12, global average is 10. That looks pretty good. I don't know if that's a ChatGPT or Copilot or whatever. Here's the World Bank. That would be a pretty reliable source. Yeah, I mean, so you see how easy that extra 5 points is on this paper. You can just Google something that you're curious about and put that in there. This one's related to Affordable Care Act. So I just want to show you at the time that bill was passed, what President Obama was looking at and what he was dealing with. Yeah, and here's, for the Affordable Care Act, expanding Medicaid. Some states refuse to do it, like Texas, because they're worried that the government would subsidize it for a few years, and after a few years, it all get dumped back on the states. So some states were like, we don't take that. Some states like Kansas, I think, refused it first and then accepted it later. There's a lot of debate in Texas of why Texas refused to join that. America's healthcare system is terrible at controlling costs for two main reasons. First, insurers and Medicare usually pay doctors when they deliver services rather than when they keep patients well. Where do I have that? So this is one I have under the problems. This one's pretty easy to fill in. Focus on treatment over prevention. Very similar to that second article. We just assume health insurance is the solution. Now think about on your solution. This is one I talk a lot about later as we see other articles, but it's good to bring up here. Should insurers pay for gym membership? So one solution, let's talk about this. So let's take diabetes, drugs. They're very expensive, right? Let's say this is $14,000 a year. What if insurance said, you exercise, get your weight to X, and we pay you $5,000 in 1 year. So the insurance company is going to pay the $14,000 for the drug, but if in 1 year you've hit certain milestones, we'll pay you $1,000. We'll send you a check for $1,000. Would that be enough incentive? Would that change things? Is 5,000 enough? Doesn't it be 10,000? What would be enough? So is that the problem with our healthcare system? Is that when people are struggling with diabetes and they just need to exercise and all this, is that the problem? They're just not getting paid enough money. So I'm not a big believer in this one, mainly because health is the ultimate consumer good. I've talked about that before. I think the incentive's already there. I think everybody here has a strong incentive to be healthy. So I think there's something else going on. So maybe it's not money. and incentives. Maybe it is, we'll talk about this, maybe it's the food industry. Is the food industry putting too many preservatives, too much sugar, too much fructose in our foods that make us addicted? Is it our culture that encourages sitting? I don't know. So is it simply a matter of, you know what, I'd really exercise, but no one's paying me to do it, so I don't. I mean, you only get one body, right? You don't get to switch out when you turn 60. I know people my age that would love to switch out. They could. My brother was the best modeler in the state of Texas in high school, and he's a Baptist preacher, which means every time he's invited over to anyone's house, it's like cakes and pies, and so it's tough for him, and he's tried his hardest, but it's just really, really tough. It's not easy in the United States. Or is Japan the solution where they really focus in on that in the education side? Who knows what the solution is, but would money do it? You just tell people. So that's kind of the question here is, what if insurance and Medicare's actually started paying for other things? Is the only reason people are taking medicine instead of going to the gym because insurance is paying for it. If the insurance would pay for their gym membership, they would do that. So think through that. This is something, I don't even give you credit for going out on Facebook and doing a poll on Facebook. If an insurance company said they'd pay you $5,000 if you exercise and got to a certain target weight, would that be enough? So whatever you want to say. So this is implying that the problem is insurance and Medicare only pays for the healthcare system. It doesn't pay for other things. We saw some of that in that second article where you say, you have this $1.77 million. What if you paid that to put bike lanes in, to get gym membership, those other things, instead of spending it just on healthcare? Second, America relies on private market doctors and insurers, yet their cost and quality remain opaque. For decades, the doctors' lobby has fought to hide detailed data on doctor prices. So this one goes under that opaque prices. I think that's right next to this one. Yeah, right here. Complexity of system and price transparency. So on Thanksgiving, you can ask somebody if you know someone in your family who's had major surgery and it's not a touchy topic. Say, you went in for surgery. I'm writing this class on healthcare system. I'm wondering how closely did you look at the bill after your surgery? What do you think they're going to say? What bill did they look at? Their deductible? Is that all they cared about? Did they say, I could have gone to Methodist Hospital and saved 10%? Did any of them say that? What happens to their deductible if they spend, instead of their surgery costing 80,000, only cost 70,000? What happens to their deductible? Nothing. Do they care? So, but those kind of questions you can ask and put it into your paper and just see, did you care about the bill at all? Did you even look at the bill? Or all you care about was what the insurance paid for? Do you think anyone asked, you're taking me to the Methodist, but I think if I go to this other hospital, I think it's cheaper there. Does anyone even care? They just go to the hospital their doctor tells them to go to. It's in network. That's all they care about. So we don't know anything about costs. Why? Because there's a lack of price transparency. But also the issue is, but we don't care anyway. Because insurance is paying. So if our deductible doesn't change, whether we do A, B, C, or D, what do we care? I don't know what I have in our solutions on that, but I think that's part of consumerism. We'll get into it, some of the solutions that people have had on that. Patients have been left in the dark when they have visited the doctor. They have no idea what anything costs or that it all ultimately comes out of their wages, so they do not have not objected when doctors gave them unnecessary tests or overcharged. That could fit very well in that section as well as a quote. That's a pretty good quote. All right, so here we're talking about, you have several options here. If here's one, you could probably find something that is more current. You find it. I know we've done this before. Oh, I'm in the solutions. Go back to the problems. Here, inconsistent. Remember what I said on inconsistence? It's cost and quality. You got to have an example of both. So here I talked about cost. Here's another one on cost. A prostate specific antigen test, the PSA test in Philadelphia costs $20 or $407. Quality is erratic. Now look at this, and what do you notice on this graph? So there's something, I love this chart. I wish it were more current, but what do you notice about this chart? So look at mammograms, look at that range. Look at PSA tests, look at that range. What do you notice about dermatologists? Real similar. Why is that? We already talked about that. What's different about dermatologists versus PSA and mammograms? A lot of it's not covered by insurance. Exactly. Y'all see how these charts just stick out. I love this chart. I just wish it were a little more current. I forget when this article was written. It's several years old, probably over a decade old, because it's back from the Affordable Care Act days. But yeah, I mean, that chart just really tells you exactly what insurance does. Why? Because the person getting the medical procedure is not paying for it. The insurance is paying for it. How could you fix it? We'll talk about this. What if this person here was told, if you go here, we'll pay you $50. We talked about that earlier in an earlier class. Would that be enough incentive? That's not an incentive to eat healthy and exercise. That's just drive an extra 5 minutes. That would probably be worth $50 to somebody. So, hey, if you go here, we'll pay you $50 and save us a whole bunch of money, over $1,500. All right, so there's an article from a decade ago. Here's a more recent one. All right, so I just want to let you know the UK is going through the exact same issues we're going to US, except for the cost. So here's the UK system, NHS, National Health Service. They have long waiting lists. This is probably the biggest issue in the UK that we don't have in the United States. We don't have long waiting lists in the United States. UK has long waiting lists. COVID was a disaster for UK, not only because a lot of people got sick and many people died, but it also just took a system that was already overburdened and just put it way, way, way behind. The waiting list, I don't know if that's 1,000 or million, probably million, meaning to wait months or even years for treatment. If you can wait years for treatment, what does that kind of imply? You may not need the treatment. If you have heart surgery and you can wait years, you say, you know what, I think I'll just go without. They had people leaving the workforce in droves. It's people barely live any longer than they did a decade ago and have some of the worst survival rates for disease such as cancers. So they definitely have their problems. Some want to overhaul their funding model, switching from a system funded by taxation. Others to one based on social insurance. Others mold the case for means tested charges, so charging wealthy people more. Turning NHS from what it has been, a sickness service, into what its name and promises, a health service, is the exact same thing, treatment over health. But to spend it productively requires a shift in focus away from hospitals to the community, from treatment to prevention, from incentivizing inputs to encouraging better outcomes. The exact same issue we're seeing in the United States. The UK is facing that exact same thing. Why? Because the whole system is based on the healthcare system. It's on hospitals and doctors. It's not based on the health of the community. Where can we spend our money to make the community healthier? Now, what to do in places like Amsterdam? How would you get to school in Amsterdam, do you think? uh, I can't, I hear words, but I don't hear them. I'm deaf. What vehicle? And a bicycle, right? So some cities, they have more bikes than cars. Would that make us healthier? I don't know. I ride my bike 4 hours a day. I think I'm pretty healthy, but I'm a weirdo. But yeah, I mean, people rode their bikes every day. That would probably have some impact. The critical question is where the money is spent. The answer to that question can be boiled down to hospitals, spending on public health, and social care has fallen in real terms over the past decade. The share of total spending allocated to primary and community care has fallen even before the pandemic. The share doled out to hospitals has risen. So it's hospitals is where they're having a problem as a share of GDP. Only American spends more on hospitals. So UK has a problem with their hospitals. It's not pharma. It's not the local clinic. It's their hospitals where they have an issue. That makes no sense. The system focuses on hospitals is one designed to treat people only after they have become really sick. That is the equivalent of buying more fire extinguishers while dismantling smoke alarms. That's a pretty good quote. Very similar in the United States, right? We're focused on treating people when they're sick versus keeping them well to begin with. The majority of health and social care spending now goes on treating long-term conditions like diabetes. This is I know this is NHS, but this is true for the United States as well. One of the issues you're going to see with the United States is end of life care. I need to make the point, this is NHS, but also the US. So you can argue, because I've seen some people trying to prove that vaccines are bad for us, and all this kind of showing how many more people have heart disease and diabetes than they had 100 years ago. Well, why is that? Because 100 years ago, people died before they could have those chronic diseases. So these chronic diseases people are living 30 years with, that used to kill them. So you can't say, wow, we're a lot sicker today. No, we're living with stuff that used to kill us. I mean, we're sicker because we're not dead. I mean, I guess that's the way you can put it. So that's really, really expensive. Most people in their 60s and 70s, you know, they've got something pretty major going on. That's several $1,000s. We're living longer, and we're living longer with conditions that used to kill us. Diabetes, high blood pressure, arthritis, all of those things are expensive, but they don't kill us. We can live a lot of ways. Such conditions are managed best by patients themselves in their own homes and with the supported networks of general practitioners. We'll talk about that solution. We're going to get into that, especially with Porter's solution, where he says focus on outcomes, not inputs, focus on health, not on treatment. So how do we do that? And we'll see his recommendations. Moving out of hospitals into communities, focus on prevention, keeping people healthy as long as possible. Socioeconomic factors, genetics, and individual behavior matter more. Obesity is a big issue in the world, not just in the US, although Japan has certainly solved that issue. The way that the NHS measures and motivates performance also needs to change. At the moment, the system is geared toward inputs, as I just mentioned. So politicians are incentivized to provide more hospitals. Top-down metrics on activity encourage hospitals to spend billions on unnecessary unwanted treatments toward end of life. Funding should be relentlessly focused on health outcomes. I'm not going to copy this one because we're going to see exactly that when we do Porter. Porter has what he calls the, so I'll give you a kind of a preview. Value is outcomes over cost. And by outcomes, he means health outcomes. So he says the value of our system should be health, how healthy are people versus the cost, which means there's times where we can spend money and make people healthier, but it's not worth it because the cost is way too much. There's other things where we're spending money and the outcomes are not that good. So a good example of this might be knee surgery. For knee surgery, surgery and rehab have the same health outcomes. People who have surgery versus people who do rehab have the same outcomes, but the surgery costs a lot more. But the system doesn't pay for rehab, it pays for surgeries. So the system setups. And so what Porter says, you look at those two and you say, hey, rehab is a fraction of the cost. 5 years later, they're exactly in the same spot. That's how we're going to measure it. So it's not just outcomes. It's outcomes versus costs. You need to measure both of those. And it's not easy to do. We'll see when we read his paper. Just measuring costs is not that easy to do. It's quite difficult. So that's what they're talking about here is focus on health outcomes. And again, this is an article about NHS. So you can see what we're talking about. The biggest solution in the United States, UK needs the exact same solution. There's another NHS. I think I'll skip through that one real quickly, but just again to prove resources are already being wasted. A report by an Institute of Fiscal Studies, a think tank, found last year that despite getting more money, more staff, NHS is less productive than it were when it was before the pandemic. What is this issue with productivity in healthcare? I don't know where to put that. Maybe on the waste. Maybe I can. This isn't really here, but man, I don't know where to put this. It's a really important issue, but I'm not sure where the. Let me see if I can find a place. Try it here. So healthcare is highly unproductive because it is the service from humans. It is hard to automate. Doesn't really fit here, but the two most unproductive parts of our economy, we talked about this earlier, education and healthcare, very human focused sectors, industries. It's really hard to automate it. What do you think the solution here is? We're going to talk about it quite a bit. Any guesses? What are you hearing in the news everywhere? What's everybody talking about? AI. Can AI be a solution? We'll get into that. AI is probably going to radically change healthcare pretty dramatically. Will it change costs? Who knows? It certainly will improve quality quite dramatically, but it will change costs. I think one area AI can really be helpful is that we all have a nurse practitioner following us around on our phones all day long. Like, you haven't moved in the last 10 minutes. Can you get up and walk around? Will that make you healthier, you think? It's like, I heard you hit the elevator button. There's a staircase off to your right. When I stay in a hotel, I try to get like on the 20th floor and then I never take the elevator. You can see me with my bike, carrying my bike down 20 flights of stairs. Like in New York, I did that. I was on like the 50th floor and took the stairs every single time up and down. And, that's good exercise, right? You just force yourself to exercise. Well, AI said, why are you taking the elevator again? You can take the stairs. You've been sitting and that's the big problem people have. You just don't think about it. You're sitting at your desk for an hour and a half. You need to get up every 10 minutes and walk around and come back. Those are the kind of things that can be huge over your lifetime. Can AI be like that trainer, that nurse practitioner sitting there? Have you drunk water in the last 10 minutes? What are you having for lunch? I don't think you should be eating that for lunch. That makes you sick. Whatever. Or will that irritate us to death? It's like having your mother with you all day long, following you around everywhere. That would be kind of irritating, but who knows? AI could be a huge factor. Any of y'all have an Apple Watch? A Garmin watch? Does it keep you healthier? Kind of, maybe. Does it give you your heart rate and your pulse and your
Tell you to stand up.
tell you to stand up? Yeah. And that is pretty huge. I tell students it's pretty ridiculous to sit at your desk watching a Zoom You have a Zoom meeting, get up and do it on your phone and walk the stairs. I used to walk the stairs at USAA all the time when I studied for the C of A exam. Up and down the stairs with my note cards. It's like no reason to stand. So some of y'all think I'm an idiot. You see me at the end of the day, I'm sprinting to my car. You have this 62-year-old professor sprinting to his car. You're probably like, what? Is there an emergency? No, I run to my car every night because running's good for you. It gets the heart rate up. It's You don't think about that because you're not 62 years old. But what happens when you're 62 if you start thinking about this now? You're in much better shape, right? What do you want your VO2 to be? Your VO2 max. You know what that is? So you want it in your 50s, right? You want a 50 VO2 max. Y'all should go look it up. You should be focused. You got to do this stuff now. How old are y'all? 20 to 29. You should be 49.6. Right? You should be really, really strong. Where is yours? You don't know it. What's your probability? Your probability of dying if you're here versus here. Here, probability of dying the next year is 1%, is 4%. Here, it's 1%. If you're here, your probability here is 40%. Here, it's 10%. Makes a big difference, doesn't it? If your VO2 is up here, your chance of dying is 1/4 what it is here. How do you get your VO2? That's your problem, right? It costs money. I'm sure the Apple Watch doesn't give it to you because you have to have a max on. I won't tell you what mine is, but it's pretty good. But, I mean, I'm sprinting to my car after class. Yeah, it's pretty good. I'm not even on the chart. You didn't even see me on the chart. So anyway, so maybe technology is going to help us with that. Who knows? But it's a very ineffective system, and that inefficiency is actually encouraged because the system gets paid more. Why? Because they hire more nurses and do more services. They get paid more money from the insurance companies. So it's an unproductive system mainly because it's a service with humans, but the system itself doesn't encourage productivity. So how do you fix that problem? Possibility of two-tier system, wealthy would pay more. So UK is trying to find some other way to fix their system. It is in really, really bad shape. If you want to lose an election in UK, you do anything. They talk about cutting back to NHS because it's safer than the UK. That's one thing that's highly favored in UK. Another suggestion for fundamental reform is Britain to switch from social insurance to a social insurance, France, Germany, Netherlands. Under a social insurance model, employees, it's almost more like Social Security or Medicare. You pay in, where Britain, they just pay out of the general tax. So the US does do this as well through Medicare. Meta-analysis suggests there is no relationship to the country's choice of funding system and its health outcomes. So you're probably not going to solve it by that part of it. I do think introducing more consumerism. One thing you notice with all these countries is no country really has consumerism involved. Most of them have the government in a big part of it, whether it's insurance or the government. There's someone else paying the bills. So I don't think you're going to solve it by just changing which kind of invisible entity pays for everything. 90% of Brits, this is why you can't change it, believe NHS should be free at the point of delivery. 84% think it should be funded through taxation. Now, why do people believe that? Are they paying less to do that? Do you pay less if you pay for it through taxes versus paying for it directly? I think you pay more, right? Because you don't have an incentive to spend less because you're paying for it indirectly. But for some people, just I'd rather pay $10,000 in taxes than $2,000 in taxes and $8,000 for insurance. But why? What do we know in the United States, though? You're not going to pay for it in taxes. Future generations are going to pay for it in taxes. So you really don't care. What do we care? My great grandkids. Y'all may be paying for it, though. Who knows? When comparing government funded or compulsory systems, only America spends a bigger share of GDP on hospitals. So US beats UK on that. So this article is arguing care closer. You're gonna see with Porter, he almost seems to say the opposite. So what Porter's gonna say is we need fewer community hospitals. You don't want to go to a hospital where the doctor, you're his or her third surgery. It's like, oh boy, I get to do another surgery. I've only done 2 of these. That's not the doctor you want to go to. You want to go to a doctor who's just done the 10,000th surgery like this. He's done 4 that day, and this you're the next one. So they actually say fewer community hospitals, but community nurses, people that are going to be out there, say making sure you're taking your medication, make sure you're exercising. That could make sense. Hospitals are primarily paid on a basis of activity, which in times incentivizes them to perform unnecessary treatments and not collaborate with other bits of the system. An estimated 10% of the cost of inpatient care in hospital was spent looking after those in their final year. We're going to talk much more about this. Meanwhile, general practice community services are often funded by fixed budgets in exchange for broadly defined services. They have very little incentive to reduce referrals. So if you get paid by treatment, you're going to do more treatment. If you're given a fixed budget, you're going to do what you can to cut back on treatments, to keep your costs down. It sucks patients to the hospital system, sucks patients into the system, and keeps them there too long, in part because a shortage of carers, more than 1 in 10 beds are occupied by people who do not need them. They're incentivized. That's that efficiency is incentivized. We'll talk more about technology. So we'll get into technology here quite a bit. Patients should soon be able to access personalized healthcare advice. So, well, again, technology, essentially what we want is you walking around with a very knowledgeable doctor, very knowledgeable dietitian, very knowledgeable fitness expert on your phone everywhere you go that you can tap into at any time, has all of your records. And I went to a place where I had to pay for it out of pocket. Very, very efficient system. They gave me a disc with all my medical information on it. I go back and reference it, compare year after year. It's pretty cool. Yeah, I really like it, except for it comes out of my pocket, so it's $2,500 to go, but it's pretty cool. But they don't accept insurance. They refuse to accept insurance. So yeah, it's a very different process. Okay, I'm getting tired of NHS. I'm going to skip through that, but if you want to read some of the NHS, I'm just trying to, let me just real quickly here, to fix their system. First is funding. Essentially, they're going to figure out how to get more money into the system. Hospital efficiency, reducing demand for unnecessary treatments. This is definitely a solution in the United States. So as I mentioned before, there's studies that show that anywhere from 1/3 to 1/2 of Medicare services are waste. They're not improving health. In fact, some of them are actually making us sicker. So here they even say replace it with health insurance. We're going to say that's not a solution either. We're trying that in the United States. All right, so enough on the NHS. All right, so let's talk more. Why is it so expensive? So we'll get a few opinions here. This is a 10-year-old article. So this again gets back to the Affordable Care Act. America's hospitals are the most expensive in the world. Trying to drive patients out of hospitals into cheaper clinics. So that is one solution. So if you go down to the solutions, this one's really easy. I think almost everybody gets credit for this. So trying to drive patients out of hospitals and into cheaper clinics. That came from, I should be telling y'all the page numbers. That came from page 26. Again, as you mentioned, we have a bunch of hospitals. The not-for-profit outnumber the for-profit by nearly 3 to 1. So if you're going to say profit's the problem, although I found a lot of like UTSA is a not-for-profit, and then UTSA is really focused on the bottom line. So I noticed not-for-profits are pretty focused on the bottom line as well. Most of these share a similar business model, sell as many services as possible, at the highest price. Doctors receive a fee for each treatment, so there are a few financial incentives to keep patients well. That gets back to that treatment versus outcomes. I'm going to probably overdo you on that one. You're going to have too many examples of that. So as many services can at highest pot. Doctors receive a fee for each treatment, so there are a few financial incentives to keep patients well. You saw that in the second article, right? The hospital made more money by killing the guy than they would have if they had treated him right the first time and not infected him. American hospitals are unusually expensive. This is the average cost per day. United States, $4,300. This is an old article. You can see the rest of the world much cheaper. I don't know what they have. They don't have the UK in there, right? The UK would be on the top of that list if they had done that. Employers have increasingly required workers to make out-of-pocket contributions toward the cost of healthcare, which makes them a bit less likely to seek treatments. We'll talk more about that. That's the consumerism side. The Affordable Care Act also includes incentives for hospitals to provide quality rather than quantity. So the Affordable Care Act, Obamacare, either way you want to call it, it does have incentives. We'll talk about these ACOs. You'll see those as well in the UK. This is an affordable care organization. They are rewarded for keeping patients' treatments below a certain level. I don't think this worked. It's not because it's not a good idea. I just don't think it had much teeth in the Affordable Care Act. It somewhat has been forgotten about. I just think it was that strong. It was a good idea, just like kind of to give people incentives, reward them for being efficient, for making their patients healthy while being efficient. But there was some in the Affordable Care Act and the Obamacare Act that definitely was focused on the value proposition, but you're not seeing a lot of examples of that working. The most seismic shift, however, is the move away from fee for service. How can a hospital profit from delivering fewer services when it's organized, deliver more? So you got to change the incentives. That's where the incentives is so important. You can't pay hospitals the way you're currently paying them and have them fix the system. Now, when you watch the movie, there's a couple of hospitals that say they have changed their model and they're making less money because of it. And so they sound like they're these superheroes. Like we decided to do better and make less money. If you believe them or not. One thing is when you see these hospitals, you might take a note and go look, like the Cleveland Clinic. What are they doing that the others don't? So the movie you're going to notice, the Cleveland Clinic, there's another one I can't remember the name of. And then their bad guy is UCLA Hospital. So the poor UCLA guy, he talks, and then the next person comes on from the good hospital and talks about how bad he was. And he's kind of pain. I don't know why he did that documentary because he just looks terrible throughout. But why are there some clinics that are doing really well, and what are they doing differently? You could certainly search that, and see what's going on. The Mayo Clinic is also on that list, although not as mentioned as often as some of these others. Rewarded for keeping patients well as opposed to paying them in quantity treatments. Again, we'll get into that with Porter. Ensure that patients do not suffer expensive relapses. Nurses scroll through records that confirm that patients have collected their prescription and had their checkups. More home visits are made to recently discharged patients. Is that the solution? So the issue there is we'll spend more money now to keep them out of the hospital for major surgery later. That's our goal. So President Obama, he somewhat said this, pay me now or pay me later is kind of the argument. He made it for more checkups. I don't agree with this part, and you'll see why I don't agree with this part. Because what's the problem with more checkups? They'll find something. So we'll get into that. We talk about cancer. There's a lot of cancers, if they find them, you're better off not getting any treatment. But most people, if you say you have cancer, they'll say cut it out, even though cutting it out is more dangerous for you than just keeping it. We'll talk about that. So I'm gonna say it's actually, this may not be the solution, more checkups, but anyway, they're looking at possible solutions to this problem. All right, here's a very current article. So again, blaming the hospitals. Many of you in this room, maybe you've never been to a hospital before in your life, but you're gonna be going more and more and more as you age. Who is to blame for America's enormous healthcare costs? The sector accounts for almost a fifth of our GDP, twice the average. We've seen that. Americans under 70 are almost twice as likely as their counterparts in similar affluent nations to die of cardiovascular diseases. Death rates due to other conditions like diabetes and kidney disease are also much higher. There's a good quote for that very first section, and a very recent one as well. So we spend much more, twice the area of the country, and yet we die of these things more than others. Cardiovascular disease, diabetes, kidney disease. This guy said, whose trial for the alleged murder of the chief of the, oh, remember this just came out. So he got donations of $740,000 for murdering this guy. I mean, that's how negative this industry is in the United States. I don't know when his trial is going to happen. It usually takes a year or two, right, before they actually start. I'm sure he's sitting in prison. I don't think they're putting him out on bond. But it should be a really, really interesting trial. We'll see. More often overlooked are America's hospitals, which took in. So here, this was about United Healthcare. A lot of that is an insurance related issue, but this article is saying it's not the insurers as much as it is the hospitals. They took in 1.5 trillion in 2023, according to the most recent government figures. That is triple the amount spent on medications. So you can't blame pharma as the biggest part of the problem because they're only a third of hospitals. Accounts for a third of America's total healthcare spending. Here's a chart you could put into your paper if you wanted to. Hospitals are a big part of it. Since 2000, hospital prices have soared 250%, growing at twice the overall rate of medical care, and triple the rate of inflation. That's a pretty good quote. Again, incentives. Skewed incentives are the explanation. Fee-for-service model where insurers pay for each test or treatment regardless of necessity, that encourages them to boost their revenue by delivering as many services as possible. That's a quote you could put under treatment versus prevention. That works pretty well there. To value-based care. So this is the Porter approach, value-based care, where value is not just the quality of the care, but it's quality versus the cost, that reward hospitals and clinics for meeting various targets. 70% of payments to providers still follow the traditional approach. That's why I'm saying that that documentary is still current today. Not much has changed since that movie was made. I doubt this 70% has changed much since that movie was made. It's compounded by pricing. The cost of procedures vary widely across hospitals. Found that the sticker price for colonoscopy in the Atlanta area ranged from $435 to $7,000. I'm going to copy that over to sorry, once we get into this, I'll start remembering where each one is. So inconsistency. $435 to $7,000. Now you might be wondering, why does the insurance company pay for this one? And that it may be the insurance doesn't pay $7,000, but the individual would. So there may be some exaggeration in these articles. It's hard for me to believe that a health insurer would pay $7,000 when they could pay just $435. And they even admit that the complexity of medical billing and nuances of reimbursement also makes it difficult to compare services effectively. So that may not be a completely accurate quote. Consolidation has made matters worse. Over $1,600 hospitals have merged. The share of total hospital beds controlled by chains rose from 58 to 81%. One or two hospital providers now dominate the market in many American cities. Mergers have brought the benefits of scale to the hospital system, but little has been passed on to patients. So you're going to see Porter is going to argue for this. We should have fewer hospitals, more concentrated in large population areas, that it's better to fly someone from some small town, fly them to Philadelphia, and have them treated in that massive hospital than have them treated in some local community hospital. They'll be better, they'll get better service, be cheaper. This article is kind of arguing that, but saying, but that efficiency is not getting passed on to the patient. Research shows that hospital mergers tend to raise prices for patients with private insurance without providing better care. Larger hospital chains often use their market power to secure higher prices. So you can't just merge and say that's the solution. You got to then change the incentives. The share of doctors affiliated with hospitals also rose. This is pretty important too. There's more and more hospitals giving up their private practice and are now becoming an employee of a hospital. Uniting different aspects of a patient's treatment in one system could improve care. So that is part of the solution, but price frequency rises after hospitals acquire doctor practices while quality remains stagnant. Medicare and private insurers tend to pay extra for services provided in hospitals rather than independent doctor's office, motivating integrated healthcare providers to encourage more costly inpatient. So we have the solution, but because the payment mechanism, the incentives are all out of whack, it's actually not working. So you've got to change more than consolidating. You've got to then change the pricing function. You're seeing more private equity firms buying hospitals. Obviously, a private equity firm, they just want to maximize income. Patients are at greater risk of falls, new infections, and other harms during hospital stays after facilities acquired by PE function. The biggest number, making up close to half, are owned by nonprofit. We already said that. Nonprofit ownership has had little to help with keeping the costs controlled. Many of these hospitals behave like for-profit. At Stanford University, 63% of operating revenue came from health services provided to the public. University of Chicago patient services contributed 56%. Is it charitable care? Some hospitals say we're so expensive because we have all these people without insurance walking in, and we got to pay for that. So for every $100, non-profit hospital spent $2.30 on charitable care, versus $3.80 for profit. So even the charitable hospitals are doing less than the for-profits, and it's not a big part. Non-profit hospitals enjoy various advantages. They pay little tax and can issue bonds at preferred rates because they're municipal bonds. So Trump both have tried to do some things here. The president issued an executive order instructing federal agencies to rapidly implement and enforce rules introduced during his first administration that require hospitals to improve transparency in their pricing. Industry analysts also expect Republican lawmakers to push for site neutrality, which would make require Medicare to pay the same rate for services where they are provided in hospitals or doctor clinics. This was a big thing you could write about. It was part of the Biden plan. So it started off with pharma. When the Affordable Care Act was approved, the only way they could get it approved was to prevent Medicare from negotiating prices. It's the only way they could get the votes. This sounds kind of stupid. And what was really stupid, when we'll talk about it in law, they spent, I think, $1 billion to create an agency to study the effectiveness of different treatments. Like, is it worth it to do knee surgery? And the only way you could get that passed, that $1 billion spending, was that it was not legal for them to use the results of those studies to influence how Medicare chose what it would pay for. Kind of stupid, right? But why is that? Well, because guess who's the largest contributor to congressional members in their campaigns? It's the healthcare system, right? So they get a lot of money from the system. You've heard Robert Kennedy pointing that out to his peers on Congress when they chew on him. He's like, yeah, but you received $800,000 from hospitals. So Trump and Biden have both said we need Medicare to start getting into the action of negotiating prices, using its huge size and influence. Disruption could be another remedy in November. A venture capital firm required Summit Health. He believes it can use technology to reshape and improve future of healthcare delivery. So we'll see. We'll talk a lot more about technology in other articles, but maybe technology can solve this. All right. So we're going to be going faster in certain places, you'll see, but you see where we're going. Are y'all keeping up with me? Because no one's slowing me down. Are y'all getting everything? Maybe it's because I'm hunting and pecking as well. All right. You can see how you're going to have your paper written by the end, right? You're going to have everything you need. So, all right. So I'm getting you ready for Thanksgiving. Don't warn your family that you're coming loaded. So just let it play out. All right. I'll stop it there.